May we move on then to clinical commissioning groups? And we have a paper on the authorisation governance arrangements from Barbara Haken, who I'll invite to introduce it. Barbara.
Thank you, Chairman. If I can take board members back initially to the kind of central tenets of the government reforms, which actually placed in the hands of partnerships of family doctors and their practices the responsibility for the commissioning, for the planning and then agreeing and making arrangements for services for patients and their public. These organisations to be called clinical commissioning groups, and the rationale for that being that general practice family doctors not only had very significant relationships with individual patients, so therefore were able to take a great deal of feedback on a day-to-day basis about their patients' views, but often had a very intimate relationships with their populations and their communities and understood their needs as well. However, it was recognised that this was quite a big ask for this group and the people who would surround and support them. At which point the concept of authorisation of clinical commissioning groups came about in order to make sure that the clinical commissioners were properly and adequately supported, so that we as a board who had a responsibility for oversight of the clinical commissioning groups could be assured on behalf of patients and the public that they had all the right competencies in order to make sure that they could oversee health services for patients, ensure patients got a comprehensive, high quality, safe services, and also take responsibility for very significant sums of public money. And in doing so, we determined that there were 6 key aspects that we thought were core to clinical commissioning groups being able to take on those functions. One of the key ones being that they could demonstrate that they were putting patients and the public at the heart of everything they did and had the right mechanisms for engaging. Secondly, that they were clinically led and clinical issues were through and through, so they were deeply committed to quality and safety for patients. Thirdly, that they had a sound, robust plan in order to ensure that the services they commissioned with the public's money were comprehensive and met all the needs. Fourthly, that they had the broad level of competencies. Lots of commissioning is about clinical areas, but there are also a huge range of other aspects that support the planning of services, that support the right contracts to ensure that providers deliver those services, and to support the monitoring of all those contracts to be absolutely sure that patients are getting the quality of services that the public's money has been used to buy. So there's one of the domains that we were looking at was to ensure that they had the full range of competencies to discharge across those areas. We wanted to be sure that they had the right leadership, and finally we wanted to be sure that they had the arrangements in place where they had to collaborate with where they needed to collaborate with one another to commission, where they needed to collaborate with local authorities to commission, and where they needed to collaborate with the NHS Commissioning Board itself. So I thought just worth reminding and taking us back to why we then set up an authorisation process, and the basis of the authorisation process being those 6 domains. In the past, the board has discussed, I think it's one of the things we've discussed at every board meeting, the different elements of authorisation, and signed off the early stages and the agreement to the data collection exercises and the nature of the site panels. This particular paper asks the board to approve the final processes in the authorisation process in order to come to the final sign-off by the board, so that CCGs across the country can be established. And also the paper attempts to give the board the appropriate assurances that as we make progress with the authorisation process, it's doing what it set out to do. I think it's important to look at those final 3 steps that we specifically finished the process. The first one, there are 2 panels, and I would like to ask the board if they would approve the constitutions of those panels. There are 2 panels that really do quite a separate function. The moderation panel is there to ensure that we have a fair, consistent and robust process across the whole country. I would use as an analogy GCSE examinations at the moment. But it is quite. I realised I said that any examination, then shall we say, because it is absolutely critical that this process is fair and consistent. So we need a set of processes in place to ensure that different parts of the country aren't assessed differently, or that different panels aren't behaving differently. But then, and vitally importantly, there is a conditions panel, and this is the panel that looks, rather than at the overarching national process, at the individual CCGs, brings together all the evidence that comes in from the processes that have gone on thus far, and determines whether the CCG should be authorised, and if so, whether any conditions need to be attached. What we've got at the moment is we've got sort of a funnel system in order to take us through, helping CCGs and supporting them to be in a position to be authorised with either no or the minimum number of conditions. The process is well underway, and if you remember, we have 4 waves. Wave 1 is already at the site visit process. CCGs can demonstrate that they meet some of the conditions that are sitting underneath the 6 domains and make up the 6 domains through the desktop exercise. Wave 1 has completed that exercise. The site visits are ongoing as we speak, and they give CCGs an opportunity to demonstrate that they've met further competencies. But there then will still be an opportunity for CCGs beyond that, through the process of the conditions panel and even up to the subcommittee panel, to demonstrate that they've met the conditions. So far, I think the feedback we've had from the process has been very positive. I think that the site visits have gone well, and the CCGs undertaking the process have said that the process has helped and has been useful in terms of their own organisational development. But nonetheless, notwithstanding that, there's still 212 CCGs in total, and a very significant task ahead of us to take this through to the end point. I think one other point I would like to make is just an understanding of the conditions that we could apply to CCGs. Plainly, those who are going through in the early waves, there will be some things which they simply cannot have completed and could not complete without the majesty of time. So in terms of the plan, in terms of the natural NHS cycle and the planning process, it will be some time after their site visits where they can put all the detail around their plans. So I think it's really important that we recognise for those CCGs that there really are 2 kinds of conditions. There are those that we would absolutely expect the CCGs to be able to meet, and it was just a question of time because they'd shown they were competent and there were other factors. And I think that what the board needs to focus on, whilst those are really important, and we will put those in place, and then through the Operations Directorate have a process for ensuring that they have passed those milestones. What I think is really critical for the board will be to determine the conditions post-April 2013, because that is the point at which the CCGs actually take on responsibility for their patients and their population's health care, and it'll be the nature of those conditions that's key. So really very happy, Chairman, to take any questions or comments, but in essence I am asking the board if this is adequate reassurance for them about the processes that we're undertaking. I think it would be important for the board to approve the terms of reference and the membership of the 2 panels which feed into the subcommittee, the moderation and the conditions panel, and then finally asking the board to agree to establish a subcommittee with the delegated authority for the final decisions on the authorisation for CCGs. I would ask, since we wrote the paper, further discussions, it is really apparent, I think, as does Paul, that the Director of Finance also has a place on the subcommittee, so with permission I'd like to ask the board to that we take these minutes with that as an addition, but with that caveat to agree that we will establish that subcommittee, which will have a very significant task and will be able to devote the time and attention to look at very specifically the process that we've gone through for authorising these individual organisations. I think the subcommittee's role is to be absolutely sure that the operational and executive process that's been undertaken is absolutely robust and that they can have confidence in the outcomes.
Thank you, Barbara. And I know that one of the additional ways in which the non-executive members of the board propose to assure themselves is by participating in a site visit, not as an active participant but as an observer, and possibly on more than one, so that we can start to truly understand what are the processes and what is the evidence that's being presented and how rigorously it's being assessed. I think it's a very important part of our own personal learning and also understanding the dynamics of the process. So let me first of all invite comments on the paper, and then I'll put the proposals to the board for approval. Yes, Moira.
Question, Chair. Just the subcommittee is time limited.
Sorry?
The subcommittee is time limited.
It is.
Yeah. So we should probably just make that clear, really, that
Yes.
it is.
We anticipate that we would meet on 4 occasions.
Each of the waves will need one subcommittee meeting to assess.
It sounds robust, just as an observation.
Yeah, without boring everyone to death, I did sit in on one of these as an observer in the way that many people I think already are doing. I did one in the East Midlands, and there are 2 or 3 things about it. One of them is to get yourselves ready for being quite difficult, because you're not allowed really to intervene or speak. So you have to kind of keep yourself holding on to the table as all these things happen, and they will ask you questions as well as you go along. But actually, I thought it was a really impressive thing. I think the assessors were really very good. They were experienced health service people and people from outside the health service. They commented to me on the training that they'd been given. They thought the training was really excellent and had got them into a place where they could do it. In terms of the process itself, I think if we see the authorisation as the 2-day visit, I think we'll misunderstand it, and I'm sure we don't. It's a really powerful forcing mechanism to get people into the right place. And whilst they were very determined to perform they'll say nevertheless to get to the place, I thought was really impressive. I do take the point, though, that on the things that they were struggling with, you could see very quickly in the next 3 or 4 months, with the information they'll get through the planning system, they'd be able to sort all of those things out. So I do think how we do that will be quite important. The other thing is, I just think we need the opportunity to reflect all the time on this, because if there are things we can adjust or change or add to it as we go along, I think we should do it. So some mechanism by which people who sit in on those things can then bring that information back to you, Barbara, and your team, so we can tweak things to make sure that they work right. It'll be a good way of doing it. But it was I was very impressed with the CCG, I have to say, as well.
That's without prejudice to any decision that will be coming to.
That's why I didn't mention their name, Chairman.
I have Jim wishing to come in.
I understand they were particularly pleased to see you.
Yeah.
I think it's a fantastic process and has been organised in a really professional and inclusive way. Just say something specific about the conditions panel, because I think there are 3 things about that are important to me. First, obviously very important to the CCG itself about what those conditions are. The second one is kind of where the matrix comes alive, and it is absolutely correct that as described here, it's led through our regions and our LATs setting and agreeing those, but I think we need to pay continued attention to keep the link on the issues alive. And I think that's worth some further reflection. And then I think it will be a very valuable source of insight to us, the picture of those conditions, because I think it will tell us a lot about how we need to support the journey of CCGs very directly. So the aggregate of those is, in a sense, our agenda of support. So I'm expecting it to tell us a lot about the capacity to lead change, about medium-term planning, and I would imagine it's something as a board we will want to use very directly in terms of it informing the wider work of the board in supporting a commissioning system coming to life, and how it sets my agenda and Bruce's and Jane's and Tim's.
Victor.
So just to be clear then, for me, because I've got some of these visits in my diary, so when we go, we take the vow of omerta, we don't say anything. but we can feed back our thoughts into, because it'll kill me, just, we can feed back our observations into some kind of process that...
You get a little pack that tells
Yeah.
you what you can and cannot do.
No, well, we can't do anything. But when afterwards, can we feed back?
Yeah.
Can we give observations?
I think the general point, so I don't think we should feed back what we thought of the
yeah.
individual,
No,
but
but
the
just-
kind of way the process operates.
Yeah, that's what I'm getting to. Yeah.
I mean, the reason
It
for
sounds
it
great,
is,
I mean,
is absolutely to protect the
Of
integrity
course.
and the fairness of the whole system, because otherwise somebody might have suggested that a visit at which David was present that had either an advantage or a disadvantage. And for the record, I got feedback that he behaved impeccably according to the rules and instructions he'd been given, and as an observer. So I do think protecting the integrity of the process is really key. And if I might make one other point, Chairman, I'm sorry I should have done things magic, and I really think this is important though, is that I'm sure the authorisation process has been robust, and I'm sure it will give us a level of assurance about these organisations, but I think it's important everybody around this table and out there recognises that these organisations will then be operating in extremely difficult environment. And I think it would be wrong to make the assumption that authorisation means that they'll have no problems and that it'll be very easy for them to undertake what is a significant task.
This is an immensely important set of decisions that we will be taking as a board, because there's only one shot at it. We have to ensure that the CCGs are as fit for purpose as they possibly can be, and ready to perform to the highest levels possible. Our function thereafter is one of both of oversight, but more importantly of support. The interaction between them and the CSUs is also going to be absolutely critical to their success. So may I invite the board to approve, first of all, the constitution and membership of the moderation panel and the conditions panel, and then with the amendment that was suggested with Paul. But then, so far as the subcommittee of the board is concerned, there's a separate paper setting out its composition in terms of reference. Is the board happy to approve that? We will need to appoint to it 3 non-executive directors. I have initial indications of willingness, perhaps even enthusiasm, from Kieran and Victor, and I think a possible third place, which I will consult on further. But are you happy to authorise me to confirm those appointments, taking chair's action?
Chairman, you can take the third as well.
Oh, thank you, Nagib. I was.
Barbara about it in the break. So.
I'm immensely grateful. Thank you. In which case we have the compliment. Thank you. Thank you very much, Barbara, for the paper and for, I have to say, the enormous amount of work that is going into making this a rigorous and successful process.
Yes, I think the team doing this have been absolutely splendid.
Well, it shows.